Hey, good evening, everyone. I'm tuning in for another BioLerner live streaming event. This evening, I'm accompanied by this kitty. I get different ones on different nights. This is Pinky. So looking forward to doing a little streaming session about sex and relationship education. Thank you all for tuning in. Let's see, we have hi Diksha, and Akash and Kanal, Aditi, Jerry, nice to see you all. Welcome. Whew, I hope that things are winding down for you guys. I know it's been a long haul this year, so good job hanging in there. We're almost there. Remember, it's our last Monday of the year. Hi, Ritvik. So I'm excited to be almost done. We have one more day of fun with sex ed. We'll do some more Q&A tomorrow and a little bit of wrap up and review and then finals. Wahoo, we made it. Got a few more people coming in. Great. Hi, Anshul. Hi, Eric. Finals? What about finals, Diksha? Hi, Colin. Good to see ya. Super stressful. But you made it through the first round. You'll make it through this one, I promise. Oh, look at that. Got another kitty. There's Benny. 2 of them tonight. That's pretty good. Let's see, pig practicals. You know, I never actually turned them back, Ritvik, because honestly, the answer sheets are not that exciting. I will post the scores. They're actually ready to go. I was going to put them in this evening. I just haven't gotten to it yet. So I'll either do it tonight when I'm done with this live stream or tomorrow at the latest. So you'll get everything all updated. And I'll keep doing a bunch of great updates in the next week or so that you guys know where you stand. So just stay tuned. So let's see, in regards to tomorrow, I'll see if I can answer some general questions before the specific ones come in. Let's see, what you can expect for the quiz. There's going to be 3 matching sections, one covering, let's see, what are they covering? One is covering STIs, one is covering contraception, and one is about the gender sexuality terms. And then there are some open-ended questions where you get to practice a little communication and you get to play the role of sexual health counselor answering people's questions. So I think you guys are ready for that now. Never thought you'd say that about yourself, did you? So feel free if you want to clarify anything. You want to make sure you can distinguish the different features of the STIs. We practiced that in class a little bit. Nothing really different than what we already did in the sort of pair share exercise. Contraception, same thing, just distinguishing the major features in terms of effectiveness and how you use them and things like that. Real basic descriptions of the gender sexuality terms. And then, again, a little bit of personal situations and how people would handle those based on the things we've gone over in class. Yes, as far as open note, I know I don't do that very often, huh? But for this one, I just feel like it's better. I don't want you guys spending a lot of time feeling like you need to copy information about STIs or contraception. This is the kind of material that if you need it in your life, you're going to look it up. So it's not something I feel like you need to memorize. I'm more concerned that you understand how to use the information. So you're welcome to use anything. What I would recommend, though, is that you have it all sort of organized, because I can't give you sort of an endless amount of time on the test to poke through things. So just have, your brief little lists and references ready to go, so you can just quickly flip through your papers and find the things that you need during the quiz. But yes, you're welcome to use any of your materials that I've given you during this unit. The quiz is currently, I believe it's going to be 36 points. So, it's about the right size for a quiz for covering 2.5 weeks or so. Keep in mind that the major exams are 100, so it's not a huge, enormous quiz, but it's kind of a small to medium quiz. Hi, Tommy. We'll probably finish it in about, I hope less than half an hour tomorrow, because I'd like to do a few other things. So as I said, there's just 3 matching sections. Those are really quick. And then there are 3 sort of short answer ones. Those will take you a few minutes more. Eric, 4. 4 what? Well, we need to know about the consent and relationship material. You bet. So remember I said there were some open-ended questions, so some of those are going to relate to consent and some communication skills around relationships. So make sure you've got the basic ideas. Really, this isn't rocket science, but just make sure you've got some of the basic ideas around what consent is and what rules apply to consent, and things like distinguishing healthy and unhealthy relationships, and how you can talk about things like STIs and contraception in the context of a relationship. Ritvik, what does it mean by STDs facilitate HIV transmission? Good question. What that means is that there's a lot of evidence that if you already have some kind of STD, say that you have herpes, that you're more likely to have HIV transmitted. And what that means is that if you're exposed to HIV, you don't always get it. It's not actually that easy for the virus to be transmitted from one person to another. But we know that if a person has something like HSV, which is herpes, and they are exposed to HIV from another person, they're more likely to actually get it. And that could be because their immune system is affected. It could be because the skin itself is affected, right? That it's more likely to get a virus transmitted into it. So there's a number of reasons for that, but you tend to have a higher risk of getting an STI if you already have one, right? So it's a good reason to just get tested on a regular basis and make sure that you don't have any kind of lingering infection that you don't know that you have. Can you upload some of the PowerPoints to the locker? I thought I had. Double check. I will check again tonight as well. I believe that I put the sexual safety one in the locker, and then there's the relationship one. I can't remember. I know I took out the old relationship one. I thought they put the new one in, but I will double check. Are the bacterial STDs the only curable ones, or are there any STD viruses that can be cured? Wow, wouldn't that be awesome? We wish we could cure some of those STD viruses. No. The viruses that you've learned about are the common ones, which are HPV, and which remembers a whole family of viruses, HSV, which is herpes 1 and 2, and things like hepatitis. So none of those has a cure, actually, unfortunately. They all can be treated one way or another, and of course there's HIV, right, human immunodeficiency virus. They can all be treated to some extent and managed, but viruses are sort of notoriously trickier. We don't really have some kind of a general antiviral kind of medication that's very effective. We have to sort of learn how to manage each one. So unfortunately there isn't, none of those are really considered curable, but they are treatable, manageable, however you want to think of it. And we can usually keep the symptoms pretty, low, pretty minor, and hopefully keep those from progressing and becoming worse, particularly HIV. Retracted. Love your shirt. Thank you, Pallavi. I know I love this shirt too. This came from another sex educator that I like a lot. And I'm kind of a sex geek, as you guys know. Hi, Lillian. How are you tonight? So another interesting thing, unrelated to this live stream, but I'll just throw it out there. This time of year, I'm always doing a ton of interviews for Stoke. Somehow I've become the resident sex ed interviewee. So they're doing a series of stories on sex ed, which I think they do every spring, springtime for sex ed. So keep an eye out for that. It'll probably be the issue that comes out either towards the end of this week or the very last week of school. That will have some interesting stories in it. About freshman sex ed and about some of the political issues I talked about some of the backlash against sex ed in some of the school districts. So there should be some interesting stuff. I'm looking forward to seeing the article. Hep C. Oh boy, you're asking me a hard question, Telmetrics. Let's see, what do I remember about Hep C? I don't talk a lot about that one specifically. I believe, if I have this correct, and you might know more than me on this, that there are drugs for Hep C, but that they're incredibly expensive. I believe there's something like that going on, that you can get treatment, but a lot of people can't afford it. It may or may not be covered by insurance, so that's more of an access problem. And also remember with hepatitis, and this is kind of a follow-up to the viral question, that we do have vaccines for many of these, right? For many of the viruses. If you think about HPV, we have vaccines for some of the major forms, and we do have vaccines for Hep A and Hep B, but not for Hep C. So that one's been a little bit more challenging. Hopefully there will be something in the future for that along the lines of a vaccine. That would be great, but not right now as far as I know. Since we don't have a kudos or study guide for the sex ed unit. Actually, you do, Colin. And I'll go back. I see a question by Ritvick. I'll come back to that in a second. So it is on your regular kudos and unit guide, just like everything else. So it really is just considered, part of our physiology unit. So go back and look at the kudos and unit guide, and you'll see some sections. I believe I want to say Physio 3C is all the sex and relationship stuff. And so you've got some questions, you've got some resources, you've also got the some vocab even on your reproductive system vocabulary list. So if you need a little bit of guidance on what's included, you can certainly look there. Hepatitis is caused by what? I'm going back to Ritvik's question. It is a virus, right? And there are these different forms of hepatitis, A, B, and C, very creative names, but they're just different forms, different strains of the virus, I guess is the right term for that. Pallavi, are there going to be questions on romantic relationships like iMessages, or is it only based on products to use and STDs? There are going to be questions based on the relationship / communication stuff. You guys are going to be answering in the first person what you could say to somebody, okay? And some of it will be from the perspective of someone dealing with a situation. Sometimes you're giving advice to someone. But you can use some of those skills we talked about in terms of how to word things. And that's partly what I'm assessing is, I want to see that you've learned some things about how to talk about sex and relationships, right? So that's something that I'm hoping you'll be able to show. Hi, Yash. Are STDs and STIs the same thing? Not exactly. As I mentioned in class, the idea is that sexually transmitted infection, that term can be used even if there's no symptoms, even if a person is not actually physically sick, they could still be carrying that bacteria or virus in their body, and that's what we mean by infected. The term sexually transmitted disease is kind of a looser term. I guess in my mind it sort of implies that you're actually sick, but it's used very loosely, and people will tend to refer to STDs and STIs interchangeably. But there is that slight distinction. And again, the reason that the term STI was originally sort of promoted was to get away from the stigma that's associated with the term STD, right? To remind us that, we're human, we get infections. Those infections may or may not make us sick, but we need to be aware if we're carrying them so that we don't transmit them to someone else. Let's see. What's the difference between Hep A, B, and C, and will we be expected to know? No, and in fact, usually during this unit, I haven't even talked about Hep C a lot, to be honest. I guess perhaps because there is no vaccine for it, so there's not a lot you can do. It's transmitted by body fluids the same as Hep B, but it's a different form, and unfortunately, the vaccine and the treatment isn't quite as good as it is for the others. So, but it is very similar to Hep B in the way that it's transmitted and such. So you're not going to be expected to know the difference. I think the reference that I have on there is just hepatitis in general. But when we talk about the sexually transmitted kind, we're usually talking about B or C. Haley, hi. You came in a bit late, but I will fill you in. I mentioned at the beginning that there'll be a few matching sections and then a few short answer questions. Thank you, Frank. See, I should have looked ahead to your message there before I said that. Yep, no problem. Thanks, Frank. For IUDs and implants, can they be removed at any time, and can you review exactly how they work to prevent pregnancy? Yes, they can be removed at any time. Of course, the intent is for them to stay in for years and years, but say you get one put in and, get an IUD put in and it's supposed to last for 10 years, and after 6 years you change your mind. That's okay. You go to the doctor and they can remove it in the same way they would remove it after 10 years. So it's really not an issue. The idea is just to have that convenience of having it last for a long time. Remember that for IUDs, there's two major kinds. There's the hormonal and the copper. The hormonal IUD works, for our purposes, a lot like the other hormonal forms of birth control and a lot like the hormonal implants. They basically change the woman's menstrual cycle. They change her normal flow of hormones, mainly doing things like thickening the cervical mucus. Sometimes they affect ovulation, things like that, to make it much harder for the sperm to ever get to the egg, or maybe there won't even be an egg to fertilize. The copper IUD is a little bit different. That actually has a similar effect on the mucus, but it also directly acts as a spermicide. So it's a super effective form because it sort of prevents the sperm from getting to the egg, and in some cases actually directly kills it. So that is very effective. What forms of protection are most used throughout the world to prevent pregnancy? That's a great question. I actually looked up something related to that lately, but I can't remember all the details. Sterilization is actually pretty common around the world. In many parts of the world, It's more, I think it tends to be by income and by parts of the world, whether female or male sterilization is more common. Condoms are certainly used worldwide because they're inexpensive, right, and easy to obtain. Other than that, it's going to depend what part of the world you're in, what the resources are, what the kind of medical care available is to people, right, whether they have some of the more expensive and types of contraception that you need medical care to gain access to. Let's see, what type of products will we be expected to know about? I'm not sure if you mean from the drugstore scavenger hunt. There's actually not a lot on the quiz about that, to be honest. We just expanded the scavenger hunt this year to include a little bit more detail on some of the products, and we didn't actually, I didn't even think about putting that on the quiz. I'm actually going to make myself a note right now about that to consider that for the future. But for now, that was partly just for your own use in case you need some of those products, particularly the things that you can use to address UTIs or yeast infections. But there's not, right? I mean, there's not. I just finished the quiz this afternoon, and there's no specific questions about those kinds of products. Will spelling count? Do your best. We should be able to understand you. The words aren't too hard. Do your best, okay? Don't worry about it too much. Anshal's asking about the implant preventing pregnancy. Let's wait a while to see if somebody answers that, because I just went over that. It's just another hormonal form of birth control with some of the effects I mentioned a few moments ago. Are we supposed to know what is on the gender and sexuality matching sheet? Not every single thing. What I tried to do was stick to the way more common ones, right? I mean, I think you guys knew when you read that sheet that there were some you'd heard of many times, like, transgender and gay and bisexual, some of these terms that we use more commonly. So I tried to stick with some of those more common ones for the quiz. So I don't think any of the ones on the quiz are going to be like ones that you've never heard before, right? So just make sure you know the meanings of the most common terms that we've hit a number of times in class, and you should be fine. TQ is asking, are genital warts or herpes dangerous at all, or are they just mild annoyances? Really, they're just mild annoyances. Both of those are skin conditions, right? And as much as it feels icky to have things, especially on the skin of our genitals, they're really harmless. Warts all over your body are more or less harmless. They cause like a bump, which often, if you've ever had a wart, I've had them on my hands and such, you don't even feel them. It just makes a bump, which sometimes your body gets rid of after a while, sometimes it doesn't, but it doesn't really harm you at all. As far as herpes, same thing. It can be more annoying than warts in the sense that the sores can be like itchy and painful and inflamed when you have an outbreak. Again, if you've had a cold sore, you know how this feels, right? It turns into this little sort of blistery thing, and it can be very uncomfortable for a certain period of time. Fortunately, we do have medications that sort of keep that down. It's not going to hurt you. It's certainly not going to kill you. Probably the most significant thing about it is it might put you at higher risk for having HIV transmitted to you, as we mentioned before, if you're in contact with that, which is going to be fairly unusual for most people. But no, generally speaking, those are mild annoyances. And in fact, a lot of doctors won't even test for herpes anymore because they feel like it's really so minor in terms of people's actual health. Is the test mostly on the scientific side or the communication relationship side? A little of each, Sophia. About half and half, actually. About half and half. The matching is more the technical stuff. The short answer is more the communication relationship stuff. So just, feel confident that you can tackle both. How do the patch, ring, and diaphragm work? Actually, let me back up to Frank Liu. I answered your question, Frank, a bit ago. Okay, you already caught it, so I'm going to move on. So, Ritvik, the patch and the ring are just more forms of hormonal birth control. Both the patch and the ring are applied weekly, so the pills are taken every day for 3 weeks, and then you stop for a week. Sometimes the woman has a period during that time. The patch and the ring are similar, except you just put them on once a week. You might have seen them when we had our show and tell in class. The patch basically looks like a little Band-Aid, and you put it on about once a week for 3 weeks, then take a week off. The ring goes inside the woman's vagina. It's a sort of soft, flexible ring, and it just goes up inside for a week. You replace it for 3 weeks, and then again a week off. And all they do is just release hormones. The hormones can be absorbed through the skin, they can be absorbed through the vagina, or you can take them orally. They more or less work in similar ways. There's some slight differences that are marketed in different ways because some women like certain types of patterns of hormones that might reduce their period or give them a period less often or something like that. But generally speaking, it's very similar in terms of how they work on the body. Diaphragm is totally different. Diaphragm is essentially a barrier. I didn't show them this year because they're not that common anymore, especially for younger people, but it's essentially it kind of looks like a little cup, and you sort of squeeze it and you put it up inside the woman's vagina up against the cervix. So it literally sort of, goes up against, maybe the cervix is more like this, right? And it sort of covers it up, okay? So that the sperm basically just can't get in. And what you do is you coat it with spermicide, so it makes it difficult for the sperm to literally get through and get to the egg. Some women like that because you can sort of hide it away before you have intercourse. You put it in and out each time you're going to have intercourse. But again, it's a bit, to be honest, now it's a bit of an old-fashioned form of contraception. There are people still using it, but it's not one that we typically recommend to younger people because, frankly, we have far more effective forms of contraception that are easier to use. So I don't even talk about those very much anymore. Lillian, there is no maximum amount of notes. You can use whatever you want. Again, it just needs to be something that you can work through pretty quickly because what I will limit is time because I don't want to spend the entire time on the quiz. But you can add whatever notes you want. You can do whatever you want, right? I want you guys to know this information and to have good resources for that. Sophia, just to clarify, condoms don't prevent pregnancy, right? Only STDs. I wouldn't say they don't prevent pregnancy. Clearly they can. They act as a barrier. They can prevent the sperm and the semen from getting to the egg. What I was trying to emphasize in class is they're not the most effective way to prevent pregnancy, right? That the failure rate is relatively high, both because there's a lot of user error. It's really easy for people not even so much to use them incorrectly, although that's possible. You can use them incorrectly. More commonly, people just don't use them consistently. They think, oh, just this one time, I won't. And then that's the one time they get pregnant. So there's a lot of condom babies out there. The effectiveness rate is really not much better than just withdrawal. So it's really not considered very effective compared to the hormonal methods in the IUD that we now have available. So again, I want to specify it's not that it doesn't prevent pregnancy. It just doesn't prevent it particularly well, okay, with actual use. And remember, it doesn't prevent all STDs either. It's just the only thing we've got, right? Other than, I guess, the drugs that now help to prevent transmission of HIV. But, for some kinds of STDs, condoms can work quite effectively. And actually for something like HIV, they're fairly effective because they stop the fluid. For other types, things that are easily transmitted like, HPV or HSV where they can be on the skin, condoms are just not going to be as effective, right? There's a lot of skin rubbing around and you're much more likely to spread that even if you have a condom. It does reduce the risk, and certainly it's worth doing in terms of reducing your risk, because if it reduces it from, I don't know, I'm kind of making this up, but if it reduces it from 80% to 20%, hey, that's pretty good, right? And is probably worthwhile if you want to significantly reduce your risk of getting those infections. But just know, it's not 100%. It's pretty hard to get that kind of guarantee about much of anything in life, right? Colin's asking, is it convenient to get IUDs? Like for somebody like high school students. It kind of depends, of course, what you mean by convenient. Any high school student can go to a Planned Parenthood clinic or even to their family doctor if they're able to do that and get an IUD put in. It's not difficult. They can do it right in a few minutes in the doctor's office. So in that sense, it's convenient. That being said, if you had to just pay out of your pocket, it would be fairly expensive because you would have these doctors visit and the devices. It could be several $100s. The good thing is if you don't have money or much money, Planned Parenthood will help to subsidize that cost. Also, if you have insurance through your family or through a university health plan, then you can use that as well. So hopefully it wouldn't end up costing you much of anything. What's convenient about them is the fact that they last for so long without you having to do anything, and they're so reliable. So that's really the best thing. Ritvik, cold sores are a type of STI, right? In a way, cold sores are HSV-1, mostly. Technically, HSV-1 is usually referred to as oral herpes. HSV-2 is referred to as genital herpes. It is possible, however, for the HSV-1 virus to infect a person's genitals and for the HSV-2 virus to infect a person's oral area, meaning their mouth, their lips. It's just not as common. I guess the thing to remember is that if you have cold sores on your mouth, that doesn't have to be spread via sex, right? It could spread from your fingers touching your mouth. It could spread from, hugging a child and kissing them on the cheek or something like that. So those don't have to be spread through sexual contact. If it's genital herpes, it's much more likely, obviously, to be spread with genital contact, certainly with oral sex, right? So in that sense, it's... HSV2 is more likely to be transmitted sexually. But certainly if you were kissing someone with HSV1, yeah, you certainly could transmit it that way. And the odds are higher if you're having a current outbreak, meaning you have sores. But it is important to realize that once you're positive, you can transmit it at any time. Victor is asking if cold sores are a symptom of herpes. Yes, so cold sores is the word I want to say is manifestation. That's like how it shows. Remember that you always have the virus for the rest of your life, right? But that you don't always get sores. So when you get a sore, it's called an outbreak. And some people with the virus get outbreaks a lot, and it's fairly bothersome to them, and they use medication to sort of manage that. For other people, they get an outbreak once in their life, not at all, very occasionally, and it's not a huge big deal, right? But if you do get cold sores, that is an indication that you have the HSV1 virus in your body, as most people do. You're welcome, Ritvik. Diksha, will this be on the final? Yes, it will. So there'll be a section on the final for sex ed, just as there would be for any other section that we've studied this year, right? It's certainly part of human biology. Victor, are unplanned babies still a somewhat common thing nowadays? It depends who you're talking about, Victor. The good news is that the rate of unplanned pregnancy in the United States has been dropping for several years now. I'd like to think that's in part due to good comprehensive sex ed, also in part due to better access to more effective contraception, right? Also, the unplanned pregnancy rate does depend a lot on some social and political kinds of factors. Can people get access to good contraception? Do they have opportunities in their life that they might want to choose to follow and take contraception more seriously rather than getting pregnant at a younger age, or perhaps just not following through with contraception and having an unplanned pregnancy. So it depends where you're talking about, but in many parts of the world where people have access to contraception, unplanned pregnancies have been dropping. So that's good news. Not everywhere, and not even in all parts of the United States, though, is that true. Let's see. Diksha, what forms of contraception will we need to know? I'm going to stick with the major ones, meaning the ones that we've spent time on in class, things like IUDs and hormonal methods, a little bit with condoms, sterilization, withdrawal. And again, the fact that those are listed as contraceptives doesn't mean that they're equally effective, right? So, that's one of the things I do want you to understand is they still are contraceptives. Some are just more effective than others, right? But they're all options. Tanmay, how much time do we have to take the quiz and how many questions? Oh, I'm hoping to get it done in like 25, 30 minutes. We'll see how it goes. And again, three sets of matching. Each one has I think 4 little prompts. And then the 3 sort of short answer ones. You should be fine. I've done a similar format in the past. It hasn't been much of a problem. K-Soft, the guy, went ahead and just answered about the format again. Thanks, Victor. Oh, thank you guys. You're all following up for me. It's funny. I don't actually think when I look at the quiz, it's not terribly difficult. However, I'll tell you, students did struggle a little bit in the past, particularly with the matching section. They're multiple matching. And that a lot of people find that format challenging. When I look at the individual prompts, none of them seems very difficult to me. But I think it's just remembering to check each possible answer choice when it's multiple matching, right? And try not to let things slip through the cracks. Just kind of evaluate each one like its own little question, right? And I think that's a little bit challenging for people, just that format, even though I don't think the information is all that difficult. And again, I've really sort of previewed most of the questions in class, so I hope you won't find it too challenging. And what I'll probably do for timing tomorrow, I still want to answer some more questions from the question box. We didn't get to all those yet, and there's some interesting ones coming up. And then I have a little wrap up for the unit as well. But I'll probably do the quiz first because I know that when there's a quiz, everybody's got that on their mind. So we'll probably do that the first part of the period and then come back and do the other things. It's multiple matching diksha, so there's not a word bank. It's, like you've had multiple matching before. I mean, I guess it's sort of a word bank. There'll be a list of terms, and then you use the prompts to sort of determine which ones apply to that prompt. Okay, Rule is asking, can STDs be passed on from a pregnant woman to the baby before it is born, or is it only when the baby is born? Good question. It's going to depend, and you understand more about this now. It's going to depend if that pathogen can cross through the placenta, right? So typically bacteria cannot cross through, so the bacterial STIs are transmitted usually when the baby's born because they're present in the vagina as the baby's passing through. For the viral STIs, some of them can pass through the placenta, and the baby will be infected before it's born. And I believe that's often the case with HIV. It's gotten... I haven't really kept up with all the modern things with HIV. They may be able to give medication to the pregnant mothers now to keep that transmission from happening, because the current medications do what's called reduce the viral load, which basically reduces the sort of number or concentration of the viruses in the woman's body. I don't know if they can give her all the same drugs when she's pregnant. For example, would those drugs cause problems in the fetus? I'm not sure about that. But I think there is some effort made to prevent transmission prenatally. And then remember, there's the option of potentially delivering a baby by cesarean section if you want to prevent the baby from passing through the vagina and picking up infections that way. With things like herpes, I think those are going to be more likely to be transmitted when the baby's passing through the vagina, particularly if the mother is having an outbreak at that time. I don't believe that HSV passes through the placenta. I don't remember hearing that, but it's possible. I'm not sure why some viruses do and some don't. That would be an interesting thing to find out. And it's also very possible that some are passed on and we just never know. Could HPV be passed on? Probably. But most of the time our bodies just clear it anyway, and we don't have any way of testing for it. So, I don't know. Maybe it does, but it's not really a problem. Let's see. I'm waiting for some more questions. Let me see if I can give you any hints about the short answer. You'd certainly want to know about some emergency kinds of things that are needed sometimes in various situations. I'll leave it at that. And for both pregnancy and STIs. Let's see. What else would be helpful? A little bit about consent. Can an IUD poke or damage the uterus? I imagine if it's not put in well, I don't know if you guys took it out of the little sort of uterus sample that I had out on the show and tell day. They are soft and flexible, and they're sort of bendy, so when you put it in, it sort of just squishes in. It shouldn't damage it. Now, am I going to say that's never happened? Of course not. It's probably happened, right? The more significant thing that you hear about is once in a while they actually come out on their own, like without going back to the doctor to have it removed. And sometimes the woman doesn't notice and then becomes pregnant, right? It doesn't happen often, but that's actually more of the problem that I've heard. I haven't heard a lot of it damaging the uterus. Again, they are kind of a soft, flexible plastic. But I'm sure it's possible. And some people, like any medical procedure, some people don't react well, and you have to sort of back up and do something different. But again, the vast majority of the time it seems to work quite well. Pallavi, you're allowed to use any of the papers I gave you. Again, this is the kind of information where it's not really about memorizing. I mean, you guys are probably going to have to look this stuff up again later in your life. I really just want to see, do you have an understanding of the things that we've studied, such that you can answer some questions about it and use the information. But it shouldn't be like massive memorization. I guess that being said, there are some questions about sex ed on the final, and you'll have your note card, I suppose, but don't, again, feel like you need to write down every possible piece of information. It won't be that detailed. It'll be big general ideas that I think you can all answer right now without notes. Which STIs can pass through a condom? Raghu, I don't think very much can pass through a condom, because remember, that's actually, that's the purpose of a condom, right, is to be a barrier. And if you recall, oh boy, cat fur all over my black shirt. I'll deal with that later. If you recall, we did that condom lab, right? And you saw that not much could pass through a condom. Some things could, some really tiny, more molecular things, right? Viruses are somewhat small, but they're still bigger than most molecules, right? So go back to that sizing scale. So it's not that STIs can pass through condoms, but they can certainly touch the skin around them. And condoms do slide around a little bit. Sometimes they come off, sometimes they break. So, again, you're going to have some possibility for transmission even with a condom. But it's not because they're getting through the material of the condom, unless you're talking about lambskin. Okay, so remember when we did the condom lab, right, that the lambskin condoms you were able to determine had bigger openings. So one of the reasons that those aren't used as commonly is because they stop sperm quite well, but not necessarily some of the viruses, right? So it does matter the size of what you're talking about. Victor, do we need to know specific numbers, like the time window for using emergency contraceptive? No, that's not something I'd have you memorize. I say for good life knowledge, know that it is a fairly short period of time, 3 to 5 days. And that should sort of make sense, because that's the amount of time, when you learned about how the egg has to be fertilized in the fallopian tubes, et cetera, it takes a couple, 2-3 days for the egg to make it through the fallopian tubes and into the uterus, and then you've got the sperm, which is working its way up, right? So you get this like 3, 4, 5 day at the most window of time, and that's when you're trying to get that emergency contraception to work before the sperm even gets to the egg, right? If you can prevent the sperm from getting there, then you can potentially prevent that pregnancy. So that's really the main thing to understand about that window of time. And, some of the forms of emergency contraception are effective mostly like right after you have unprotected sex. Some of them are actually just as effective 3-4 days later, right? Remember that the copper IUD can be used as very effective emergency contraception. And then you can even leave it in there and continue to use it as long-term contraception. Let's see. Jesus. Yes, I remember you from a previous live stream. Lillian, what is Paris and nulliparous? Those aren't terms that I covered. I believe those mean how many children you've had. So I think nulliparous is when you haven't had any, I shouldn't say children. I think it means the number of pregnancies you've had. So if I've got this right, nulliparous means you haven't had any pregnancies, at least that you know of. And parous would mean that you have. And keep in mind that not all pregnancies result in a child. Right? People can have a pregnancy that ends in miscarriage, or they could have an abortion, and that would potentially still count as a pregnancy. You can also have a stillbirth, right? Which is when the baby is already dead by the time it's delivered. Again, not something I'll cover on the quiz, but it is a term you see, particularly on medical. I've seen that on medical forms when you have to fill in and talk about the number of pregnancies. We need to know the percentages of unintended pregnancies for each form of birth control. Whew, that would be a lot to remember, Akash. No, you don't need to know any actual numbers. Again, what is the main point? I want you to get the relative effectiveness, right? I suppose, I happen to know off the top of my head that those very effective ones are in the 99% range. That's pretty good, right? But generally speaking, you just want to know that there's a distinct difference between the very good ones. Okay, remember I showed you that chart that was all on one page. In fact, you have it on the back of your birth control options sheet. You've got the super high level effective ones like implants and sterilization and IUDs. You've got the next level down, which is the hormonal, pill, patch, shot, whatever. And then you've got the level below that, which is everything else that's not so good, right? So condoms, withdrawal, diaphragms, things like that. I think that's where diaphragms are. So yeah, no, just the general relative effectiveness, not the actual percentages. That's not something we need to worry about. And good point take, you. If it did come up, you do have your notes. So Raghu says to clarify, does sexual assault not necessarily include rape, but rape does count as sexual assault as well, right? Yeah, that was a little unclear to me, Raghu, too. I looked it up, and the descriptions I saw said that sexual assault was this big umbrella term that covered lots of different things, including rape. But then if you look up some of the legalities, when you actually press charges against someone, you can press charges, I believe, separately for sexual assault versus rape. I'm not quite sure what the distinction is there. That's, lawyerly stuff. But know that sexual assault is certainly a bigger umbrella, that there's lots of other kinds of things that would count as sexual assault, touching someone or something like that, that wouldn't necessarily count as rape. So to count as rape, it has to be penetration of the body somehow, right? So sexual assault is this much broader window that could include other kinds of things. Sexual assault is kind of a useful term if you're not quite sure what happened, right? And you could just use that term as sort of this umbrella rather than having something more specific. Let's see. Eric is asking about the laws regarding abortion, and can you explain what happens during this process? Well, the laws are different from state to state. I think you guys are aware this is highly political, right? At the federal level, abortion is generally legal in this country, but there are a number of restrictions that have been put on when people can have an abortion, where they can be done, things like that. In addition, states can put their own restrictions, and they can be strict restrictions about, minors having abortions, the kinds of facilities, again, that abortions could be done in. Some of those are done out of concern for safety. Some are done to restrict access if people don't believe that abortion should be a right. They will try to pass laws that make it just frankly harder to get one, harder to find a clinic in the area that offers one. There may be restrictions on how they're paid for, whether insurance has to cover them, things like that. So there's a lot of different laws that have to do with access to abortion. Here in California, it is relatively available compared to other states, depending where you are in California. Certainly in an urban area like the Bay Area, it's more available than in many areas. In terms of what happens, there's two major kinds. One type is essentially surgical, where they just go in through the woman's vagina and basically sort of clean out the lining of the endometrium so that they would, sort of take out the developing embryo and the placenta and just sort of take it out of the woman. And then sort of clean up the tissue in the inside of the uterus so that it remains healthy. The second type is going to be what they call a medical abortion. I think that's what it's called, when you use drugs. And it's essentially certain drugs that cause a woman to miscarry, so that you would take the drugs and then you would miscarry, and the blood and the tissue would come out of the woman's vagina, similar to sort of having a heavy period, and that would cause the embryo to release and the placenta to release and to come out, and that would end the pregnancy. And which one of those are done is going to depend on, a number of factors in terms of how far the pregnancy is along. I don't know if it depends on the clinic or the woman's preference or whatever as well. I'm not sure about that, but those are the two major types. Some parts of the world you can get the drugs that cause this, you can get them more easily. In the United States, those drugs are fairly more restricted, and you can get them some places but not others. Where have you posted the PowerPoint that we looked at in class today? I think I took out last year's, and then I don't remember. I can't remember if I posted it or decided not to post it because I wasn't sure anybody cared, but I will make a note to post it because you're the second person to ask. So I will be happy to post that. There's a folder that's sex and relationship education inside of the physiology folder in the locker. Okay? So I will double check after this live stream and make sure that gets posted if you guys want to check it out. Is the reason that isn't part of our main curriculum for sex ed that's very controversial or debatable? Not necessarily. I mean, I've talked about it several times in class. Where it's actually required by state law is that we talk about pregnancy options, which I tend to do very briefly, only because I feel like it's at this point kind of not the main thing you guys are concerned about. But I do briefly touch in class on the idea that if you become pregnant, you essentially have three options, right? You continue the pregnancy and have the child. You can choose to give that child up for abortion. For adoption is what I meant to say. So your three options are that you continue the pregnancy and you have the child and raise the child as your own. Second option is you continue the pregnancy, but you give the baby up for adoption, and the third option is that you have an abortion, right? The other thing that I don't always mention at length in class, but that is good for people to be aware of, is that if you do have a child and you don't want it, that there are places that you can actually take that baby to, called safe havens, places like fire stations where you can take a newborn infant that you just feel like you can't handle, right? And that's so that people, won't do anything to hurt it, that if they feel desperate, they have a place that they can go. So, know that that exists. But that's basically what's required by the law to cover, and I don't spend a lot of other time on that because it just hasn't been a big issue for us here. I'm not saying that it never happens. Certainly there are students who get pregnant at Monte Vista. I know there have been. For the most part, to my knowledge, they usually get an abortion. It's not terribly accepted in our culture to be pregnant as a high school student and to have a child. But know that, there's plenty of places here in the Bay Area, in the United States, where young people, teenagers, choose to have a baby and raise it, or choose to have a baby and give it up for adoption. So those are the options. But, I'm happy to talk about it. It is controversial, and it's certainly not my position to tell you guys what to think about abortion, but to know what the options are. Akash, we don't need to know specific anatomy. I mean, you need to know enough to understand, the things we've been talking about around pregnancy and around STIs and around contraceptions and contraceptive choices and how they work. And then, of course, for the final, the reproductive system is part of it. So I wouldn't say you don't need to know it. But there's not like a bunch of stuff on anatomy specifically in the on the quiz tomorrow. Is PID a symptom of gonorrhea? PID isn't a term I used a lot this year. I don't know why. I usually do, actually. But the idea of PID is pelvic inflammatory disease, and it just basically means that you've had an infection in your reproductive organs. It usually applies to women. I don't know if that applies to males ever or not. But I know that for women, if they've had an infection, say something like chlamydia or gonorrhea, and they've had it for a while, maybe weeks or months, and it hasn't been diagnosed, which happens because they're not always diagnosed and you don't always have symptoms. It'll just kind of keep infecting the cells of the reproductive system, and particularly in areas like the fallopian tubes, and will cause a bunch of scar tissue and infection and inflammation. And then sometimes what will happen is a person will get suddenly sick. I remember when I was in college that it was like the middle of the night, and there were sirens, and an ambulance came and picked up a young woman who was living at the co-op where I lived, and it turned out that she had PID from an undiagnosed case of chlamydia, and just suddenly became very sick, like a high fever, and feeling really horrible. And she didn't die. She went to the hospital and got antibiotics because it's a serious infection, and recovered. I mean, she was a healthy young person. It was okay. Now the possibility, though, is that she may have become infertile as a result of that, because that infection does cause scar tissue, and if the scar tissue blocks the fallopian tubes, then you can become infertile. So, but PID refers to this sort of state of infection that becomes pretty bad when your body's not able to fight it off and you get a pretty significant infection in the reproductive organs. Do we need to know symptoms of specific STIs? Neil, only in the largest sense. Like, you should have a sense that herpes is a skin problem and therefore it can be transmitted through skin contact. But it's not like, you need to know the details of this discharge or that thing, right? If you know enough about the different infections to understand how they're transmitted, bacterial, viral, and to understand whether condoms, for example, can help to prevent that transmission, you're going to know a little bit about their symptoms, right? But it's not, there's not going to be specific questions about like the symptoms of each one. And I tend to group together chlamydia and gonorrhea. Know that they are separate bacteria. They're not the same at all. But in terms of diagnosis and treatment, it's very similar. So I just sort of group them together because they're by far the most common bacterial infections. Thank you. I need a little more fur on my shirt. Thank you. Okay, getting all settled in here. Let's see. Yeah, it's sort of unfortunate. I tend to have a lot of black clothing, which is almost always covered by large amounts of cat fur. Hi, Raghav. Which STD or STI is most frequently transmitted? Let's see. The most common is thought to be HPV, but that's also grouping together like 100 different strains of HPV. So it's like saying the cold is the most common sort of infectious disease, even though we really mean all different kinds of colds, right? So HPV overall is considered the most common. Almost everybody gets that at some point if they're sexually active, but maybe not one particular strain. In terms of the thing that is transmitted the most that is one single thing, it's probably chlamydia. Chlamydia is super common in terms of things that are specifically sexually transmitted. But also remember that cold sores are super duper common, not always sexually transmitted, but I think something like 80% of the population is HSV1 positive, so that's also very common. You know, again, it's important to emphasize that STIs in general are very common. They're not these exotic things that only some people get when they have sex, right? Almost everybody who has sex gets STIs at some time or another, often more than one. They're just super common, right? Raghu's asking, how can HSV and HPV spread if you have a condom? So the idea is that, the condom is covering the penis, right? Most of the shaft of the penis and the tip. But, the skin around the penis, if say you're a male, you could have the herpes virus or HPV on your inner thighs or on your scrotum or around your anus. I mean, it's kind of just all spread around in there, and that's where you get the sores. So, if you're touching someone's genital area, if you're having intercourse, if the skin is touching the skin of the other person, you can easily transmit those, and it's just not coming through the condom or off the penis, right? Certainly, if you're female, you can have these viruses all over the vulva, right? And again, the inner thighs. So you could easily spread from one person to another if your, parts are touching, your junk is touching each other, right? And then, same thing if you have male-male or female-female contact, all you need to have is skin touching. You can also spread some of these viruses by touching with your hands and then touching yourself, right? Or touching with your mouth. So, your hands and your mouth are warm, kind of moist, right? So it's not so hard for some of these viruses to live for a little while, especially the skin ones, because they're used to living on skin anyway, so they're pretty good. HSV and HPV are relatively hardy and can live on your skin for a little bit, especially if it's kind of warm and moist. HIV not so much, but the other two, easily. Siddharth, is recording a rape considered sexual assault? That came through the question box as well. Yes, that would be a separate kind of offense, and people have been prosecuted for that kind of thing. Particularly if this is associated with, social media or something like that. But remember that if you're recording something like that, first of all, if it's a minor, it's child pornography. But, even if it's not a minor, obviously that's non-consensual. It would be considered a form of assault, separate from the rape. So even if the person who's recording it doesn't actually physically assault the person, it actually is a form of sexual assault to record that, right? Let's see. Can HIV spread if you use a condom? It's much less likely. HIV, as I mentioned before, is a for lack of a more scientific term, a wimpier virus. It's harder to transmit. It doesn't last on skin for any length of time. It doesn't last on surfaces for any length of time. It really likes to go from body fluid to nice warm body fluid. So generally speaking, almost all cases of HIV are directly from semen or vaginal fluid directly into somebody's reproductive organs, like from semen into a female's vagina. There is transmission with anal intercourse, so it could go from semen into, because you get these like micro tears with intercourse sometimes. There's few, if any, solid cases of HIV being spread by oral sex. If at all, it's going to be if there was like a cut in the person's mouth or something like that. Because again, they really need to go right into the vagina or right into blood or something like that. So it's somewhat more difficult. It is possible, for example, to transmit from female to male with vaginal fluids, but much less likely. Right? It's a lot easier, actually, for most of these STIs to be spread from male to female because they're simply like delivered inside, right? So, and then they can be spread by anal intercourse, no matter if it's male-male or male-female intercourse. So, But HIV compared to some of the other ones is actually relatively difficult to transmit. So the good thing about that is that condoms work pretty well, assuming they don't tear, right? They're going to be more effective for HIV, for preventing HIV transmission than for preventing HSV or HPV, right? Lots of initials there. Fortunately, they're almost all the same. Sorry about that. You got to keep it straight. Raghav is asking, why is the definition of rape subjective? I'm not sure what you're asking. The definition of rape is not subjective. It's a legally very clear definition. It's penetration of mouth, vagina, anus with a penis or an object, right? It's very, very clearly defined legally. And that was redone just a few years ago to sort of cover all genders and bodies and things like that. I think what you might be referring to is sexual harassment. So sexual harassment is more subjective, and that's to sort of clarify that it's really the victim that gets to decide when they're feeling harassed, right? Because otherwise it's very easy for the person who's the harasser to say, oh, I didn't mean anything by that. It was just a harmless joke, right? So it's really not about what they think. It's about how the other person feels and about the context that it's in. So for example, if it's a work environment, it's very clear that kind of behavior and that kind of joking and that kind of talking isn't acceptable, period. And it doesn't really matter sort of what the perpetrator intended by that, right? But the idea is to sort of protect people from the feeling of being harassed, right? So that the subjectivity comes in terms of whether the person feels like they're being harassed and whether they are going to pursue that. Let's see, Rag is asking, what are the specific symptoms of chlamydia, gonorrhea, and syphilis? Again, they can vary by person. So many times it's an unusual discharge. You can have different colored mucus or discharge that comes out of either the penis or the vagina. You can have pain with urination or just pain in general in the genitals or up inside the reproductive organs. Syphilis is a little more complex. We don't get into that a lot because physiologically it's a more complex thing. There's different stages of it with different kinds of symptoms. Sometimes none at all. Sometimes you get these sores in your mouth when you first have syphilis, but you would never notice them. Excuse me. The later symptoms of syphilis get pretty dramatic. You can have brain damage and blindness and all kinds of crazy stuff going on. It can make you crazy. But we didn't get into that a lot. Fortunately, these days syphilis isn't nearly as common as it has been historically, although there's still a number of cases of it, but you don't hear about it quite as much. But again, for our purposes, I'm not going to ask you about specific symptoms. Just know that sometimes they are asymptomatic, meaning sometimes there's no symptoms, and that's why testing is so important. Right? Because you could be carrying around an infection for a long time and transmitting it to other people if you don't know it. So you need to get tested for STIs, partly to prevent yourself from giving it to somebody else, but also for your own health. Because the longer these are in your body, they are doing damage, and you may not realize that you have been infected unless you get tested. Because again, they could be asymptomatic for a long time. Right? So regular testing is really important for people who are sexually active. Tanisha is asking about if you can have your own folder out or do you have to make a certain study guide. So Tanisha, I talked about that a bit earlier, but nope, open note means open note. You can use whatever you want. Okay, but again, you might want the very, very, very basics on your study card, but for the final, but you could probably live without it. Again, the questions aren't that difficult. We'll go just a few more minutes, so if you have any last questions you want to ask, go ahead and do so. And there will be a place at the bottom of the sex ed quiz, just in case you have another question that you want to ask. Try to give you lots of opportunities for questions. Okay, Raghu's asking, should we study specific anatomy and function like penis, vulva, hymen, and average lengths of erect penis and nipples? Wow, that would be a lot to know. No, you don't need to know things like average lengths. You should be able to comfortably use the anatomical terms like we have, certainly when we were doing the reproductive system. But no, that's enough. You don't need to know statistics, right? The homologous structure part is more kind of interesting, but, you should know. For example, the main one that I mentioned that I think is most interesting to know is is to know that the clitoris and the penis are homologous, and they're both very sensitive to sensation and are similar in that way. And yes, you're right, the outer labia and the scrotum are also homologous. Not super important for the quiz. It is part of your general reproductive anatomy information. But the quiz itself doesn't do a lot of anatomy. It's more focused on STIs, contraception, terminology, and then some of the communication stuff that you learned, and some of the legal things. I'm going to put a note to myself of something that I didn't put on there, but I could have. Okay, so go just another couple minutes here. I know we all have a lot to do, so I'll give you another minute if you want to enter any questions. I'll just mention before we close, you know, I've really, you guys have been a really forthright class with lots of good questions, and you know, I know you felt a little uncomfortable at the beginning of the unit, but you've just done a great job. I really appreciate it. And I really appreciate your feedback. This is actually the first year, believe it or not, I don't know why, but it's the first year that I've actually done that Google form for this unit. So I'm really excited to see your feedback. And, you know, please feel free to give me constructive feedback as well. I really want to make it a good experience for you and do it in a way that's going to be the most helpful and comfortable for you. So please give me any feedback that you can that will help me to do a better job of this. Oh, you're most welcome, Lillian. I'm glad you enjoy it. I've really been enjoying the live streams too. I'll talk in class about whether, you know, when and whether we can do one for the final exam. Raghu, regarding circumcision, again, it's not specifically on the quiz. You know, I mean, the quiz doesn't intend to cover every little thing. Some of it is just life knowledge. You know, just know in general that circumcision is somewhat now favored by the medical establishment because it does reduce infection to some extent. But, you know, it's not so enormous of an advantage that people who choose not to, it's that big of a deal. But it is slightly beneficial to do that. Let's see. Oh, you're welcome, DT. I'm glad you enjoyed it. Oh, I did. I'm not sure who you are, but welcome. Hi, Neil. You're welcome. Vidit, are you a student in another one of the bio classes? I don't recognize your name. Victor, I'm forgetting about the foreskin right now. I can't remember, and I've just read about that recently, and it's kind of just leaving my mind right now. What the whether there's, you know, if it's thought to be, if it's homologous to part of the female, or I mean, there are some advantages to having foreskin. It does protect the head of the penis a little bit. Not quite sure. Can't remember right at the moment. It's a little late. Good night, Lillian. See you tomorrow. Oh, I'm glad it helped you, Tiffany. I'll see you later. Okay, you're in Miss Chow's class. Awesome. Well, welcome. Yeah, you're always welcome to attend. I'll probably do a live stream for the final exam as well. In fact, what I'll try to do now that I'm thinking about it, I'm going to write myself yet another note here. I will try to find out if the other bio teachers are doing live streams or regular review sessions for the final. I know I was walking through Mr. Gann's class today, and he had a couple posted, I believe, for Tuesday and Thursday after school. I assume he's doing that at Monte Vista. But what I can try to do is, you know, if I find out from the other teachers that they're doing reviews, I'll let you guys know. And you guys can let each other know as well. None of us minds if you go to each other's reviews. Sometimes it's really helpful to hear things from a different person. So feel free to attend any teacher's reviews. I don't think it would bother anybody. It certainly doesn't bother me. Okay? Night, Neha. Oh, I didn't even know you were here. It's the first time I've seen your name. It'd be kind of fun if I could get like a... It'd be nice to have like a little list of like who's on at any given time, just to, so I know who's here. There's probably some way to do that I haven't figured out. One more kitty visit? Come on. There we go. One more visit. They've been on and off tonight. Say goodnight, Pinky. We're just about to go now. Good night, Victor. Show me the cat before I go. There you go. Night, night. There's his feet. It's so funny when they stick out that way. They don't actually love to be held, but I do it anyway sometimes. Oh, that's pretty funny. Okay. Well, I think I'm going to sign off here, but thank you guys so much for showing up. And if there's anything else I can do to help you, let me know. You can always feel free to shoot me an email. If it's not too late, I'll get back to you. Otherwise, I look forward to seeing y'all tomorrow for our last few days of school together. Good night. You're welcome, Akash. Take care. I'll see you tomorrow.